The dorsal recumbent position is used for vaginal and rectal examinations and for the insertion of a urinary catheter. Sometimes the dorsal recumbent position is chosen when the supine position is not comfortable for a patient with respiratory problems, a back injury, or low back pain. The patient may prefer to bend the legs rather than lying flat during the examination of the head, neck, chest, and extremities. Before beginning, perform the preliminary procedures shown earlier. Pull out the footrest of the examining table and help the patient into a sitting position. Place a drape over the patient's thighs and legs. Ask the patient to move back on the table. As the patient is doing this, pull out the table extension while supporting the patient's lower legs. Ask the patient to lie on her back. Help her if needed. Her arms can be placed above her head or alongside her body. Position the drape diagonally over the patient. The drape should be positioned diagonally with one corner over the patient's chest and the opposite corner between the patient's feet so that it completely covers the pubic area. Ask the patient to bend her knees and place each foot at the edge of the examining table with the soles of her feet flat on the table. Provide assistance during this step. Push in the table extension and the footrest. Reposition the drape as needed so that one corner is over the patient's chest and the opposite corner falls between the patient's legs and completely covers the pubic area. When the physician is ready to examine the genital area, pull up the center corner of the drape and fold it back over the knees. After the examination is finished, pull out the footrest and the table extension. Assist the patient into a supine position. As you help her into this position, check to see if she's lightheaded. If so, give the patient time to rest before helping her into a sitting position. Slide the table extension back into place while supporting the patient's lower legs. If this is the end of the examination, complete the final steps.